Lemierre Syndrome, septic internal jugular vein thrombophlebitis, otherwise known as post-anginal sepsis or Lemierre Syndrome. It is arises from the complication of deep neck space infections. The condition is commonly seen in IV drug user who are using cervical injection for the drug, and it is characterized by the formation of infectious thrombus within the IgB. This lead to the septic emboli that may precipitate metastatic foci of infections in the lungs, joints, skin, soft tissue, and other organs. This is CCT of 60-year female patient who come to me with spiking fever with history of diabetes and having 10 days back upper respiratory tract infection. Diagnosis on this history, this CCT was done, and you can see there is hypodensity in the internal jugular vein. You can see clearly this is the thrombus emboli which spread from the URTI or pharyngitis into this IgB. Most common causative agent of this is the Fusobacterium necrophorum. Other organisms are Klebsiella, Prevotella, Staphylococcus aureus. And this Fusobacterium necrophorum is typical a member of oropharyngeal flora which activate in immunocompromised patient, as this patient is immunocompromised because of diabetes. Treatment regimen involve penicillin, metronidazole or combination with clindamycin. This help to attack the infections. Other therapy involving anticoagulation therapy sometimes requires surgical intervention like surgical thrombectomy or internal jugular vein ligation is rarely required. So this Lemierre syndrome has to address with aggressive IV antibiotic therapy with added anticoagulation, sometimes required surgical intervention. Thank you so much.